Thank you, Governor. Thank you all. So as the Governor noted, I did want to spend a little bit of time today discussing multisystem inflammatory syndrome in children because, unfortunately, we continue to see more cases in the state, and as the Governor noted, tragically had our fourth MISC, as we abbreviate it, related death in the state. So multisystem inflammatory syndrome in children was first really discussed and identified early in the outbreak. The CDC has been providing alerts to those of us in the public health community and to providers across the country since mid-May. And really that followed after that first national wave of COVID cases where certainly many children were also developing COVID, and this, as a result, we were starting to see these manifestations of illness that seems to be associated with COVID-19. Now that many states, especially those of us in the Sun Belt and the South, our neighbors, are also seeing high numbers of cases, we're again seeing more and more children presenting with this syndrome. While it's a relatively rare syndrome to be associated with COVID-19, as the numbers of children that we have increase, we see more cases. So what is MISC? It appears to be largely driven by the immune system of the children, and again associated with having COVID-19. Even in adults, I'll say, one of the things that we've learned throughout this outbreak about COVID-19 or SARS-CoV-2, the virus that causes COVID-19, is that part of what challenges people and leads to poor health is the direct impact that the virus has on lungs. But this virus seems to also really trigger very strong immune responses. And those immune responses are something that's very prominent, especially in the people, adults or children, that are ending up in the intensive care units and on ventilators. And so in this case, when we're talking about MISC, essentially what we're seeing is likely the effect of the immune system responding or reacting after a COVID-19 infection. And the symptoms that children get across multiple organs are the result of that inflammation. Most children present with symptoms driven by at least 3 different organ systems. So you can think of your heart, your lungs, your kidneys. Those are all separate organ systems. And about a quarter only have about 2 organ systems involved. The most common symptom that we're seeing in children with this syndrome are a lot of GI or gastrointestinal upset, a lot of nausea and diarrhea. But right after that, about half of children also have prominent respiratory problems, breathing problems, and then a rash, having some redness of the eyes, and heart problems have also been well described in children with MISC. Right now, we don't really fully understand why COVID specifically seems to be causing the syndrome in children. Likewise, we don't have a specific treatment that we can give to children that we know of, either during their COVID infection or when they present with MISC, that prevents or treats this. Largely what we do is support children through, again, this rare but pretty significant abnormality. So nationwide, the CDC reports we've had over 570 children across the country that have developed this syndrome. In Louisiana alone, since the beginning of our outbreak, we've had reports of 44 children, including, again, 4 who passed. Ages have ranged in Louisiana between 2 months and 19 years old. There again does not appear to be a clear pattern of who is contracting MISC. One of the reasons we want to share that today is because obviously we have a large number of cases in Louisiana of COVID. And so, we're actually 4th in the nation right now for pediatric cases or children with COVID-19. And that makes us a little bit more concerned, certainly at the Department of Health and the Office of Public Health, about MISC. We are trying to raise more awareness amongst providers because we do think that supportive care, giving fluids, helping blood pressure stay up in these children is helpful. But that means that our providers across the state have to be really vigilant and have this in the back of their heads when they're seeing somebody with an otherwise unidentifiable, undiagnosable condition that fits this pattern. We want to make sure that they're giving the best care. In addition, I'll just note that in absolute numbers, that's 11,382 children across the state that have had COVID. And just like with other age groups, we're continuing to see increase in children diagnosed with COVID because we're doing more testing now amongst those children. And so we want to be really vigilant and just make sure that everybody is aware of those disorders. We have asked providers to report to us any cases of MIS-C. We just sent out another alert today to providers giving more information on what the symptoms are and how to report. And so we're hoping that we are getting a better sense of who in the state may actually have this condition.